Hi everyone, Greg Kawchuk here, and it's such a delight to be able to tell you about some of the things that I'm doing in our lab at the University of Alberta, and always a pleasure to speak to my European and UK colleagues. It's wonderful when I get a chance to visit there and hear about what you're doing as well, but in these COVID times, we'll take what we can get for a chance to interact, and I think these telehealth or remote platforms are doing a great job of keeping us connected. So with that, let me tell you a little bit about where I do my work and what we're doing and how it leads into this idea of big data. And this is my building where my lab is located, the Edmonton Clinic Health Academy. And traditionally, our group, seen here with some of the Carl Fellows, works on two areas. The first one is, how do you better understand what causes back pain and why do treatments maybe have impact in this? What are the mechanisms of the treatments themselves? And we've done some, I think, pretty good work in this area in terms of spinal stiffness. And we've showed that when people report that they get better from a manipulation, their spinal stiffness actually improves to normal levels. Whereas people who don't report that they're improving, their stiffness isn't changing. So we've shown there's significant physical change in people when they report that they've had treatment and improve. And this is helping us better understand how we better match treatments to some people and not others. How do we give the best treatment for that kind of person with that kind of back pain to get optimal results? And if we take that a little deeper, we can also look at what tissues are responsible for creating those changes. What are the tissues that change in someone who says they get better with manipulation? And what are the tissues that maybe don't change and are more difficult to address? And here you actually see some work with one of my former students, Martha Funabashi, who is performing some manipulations on an animal cadaver. We then take them into a specialized robot. And these are the actual movements that are happening within the disc and ligamentous structures as a result of the application of a manipulation. So we hope to better apply our treatments to target the specific tissues that we may need to better align treatment with particular diseases, conditions, or reports of low back pain. But that's a long haul. Discovering these mechanisms and how they work and how they are best applied in clinic is a marathon. So in the meantime, until we come up with many more of these answers, we need to do some things to help people who have back pain today. And that's the other side of our lab in terms of our research focus. And this also includes how to help clinicians. This is some new artificial or some augmented reality work that we're doing to help clinicians put some information into their visual field, and in this case, patient imaging, and to help them better understand how their treatments may be effective for people. So here we can identify a specific area in the back that's a high stiffness zone and be able to tell clinicians whether they should focus on that area specifically or move to another or avoid it. We also are the first group outside of Denmark to run the Glad Back program. We've now translated that into English, and we have successfully piloted it in Alberta. And we are now, in fact, because of COVID, able to now deliver this program online. So this is a tremendous way to expand your practice. If you don't have a way to help people take up education and exercise, two of the most powerful interventions for back pain, this is a gift. It is a fully developed program that you can simply learn about, and all the pieces are in place, and you can run it on Monday. So we're very excited to be partnering with our Danish colleagues on this. But the new area that is kind of cropping up, and especially so during COVID when we can't be in the lab on a regular basis, is big data. And how big data can be something that is really important to where the future of the profession lies. And in fact, some people have called data the new oil, something that I've said before, in that it is so powerful. Others have even said it's more important than the invention of the wheel and perhaps even fire. So our society is increasingly data-driven, evidence-based, and whoever can secure this data and use it in the most opportune ways is really going to control where healthcare goes. But before that conversation, we need to just talk a little bit about what is big data, and especially compare it to little data. And little data is the kind of thing we all learned about in school, right? We want to understand what are the characteristics of a population. So we're going to take a sample size that's representative, and we're going to talk about randomness and all these things, because there are some situations where you can't sample the entire population. If we want to know if there's pollution in this lake, we can't pull out all the water and test it. So sampling makes sense in a lot of cases when you can't measure all of the atmosphere or all of the water. But with data acquisition and internet and online surveys and things, some areas that we used to think we could only sample, we can now potentially generate information from the entire population. And so sometimes we default and say, well, we should take a sample, but if we worked a little harder, it might be possible to actually get data from everyone of who we're interested in. And this is the whole concept of a census, in that there are regions in every country or every city where thoughts and beliefs are very different from another area. So making sure you want to sample all the little bits is really difficult to get a representative view of, say, what a country thinks about a political topic. So a census or a survey that asks everyone really can do a better job of capturing what it is that population represents. But it's still response-based, right? If you ask the entire population of a particular country what their physical activity level is, you might not get an answer that is truly representative of what physical activity is for each of those persons. They may give you an answer with the best of intentions, but it still might not match up with reality. So in some ways, big data sampling of an entire population works for things when you have to give opinions, say, on your political views. But we're quickly reaching the time when we can sample whole populations for their health or their activities. And the advent of wearables is really taking us there quite quickly. We can now do things to see what people's genetics are like on whole populations, or their various blood values, or a number of other things. So we're actually taking objective measures for whole populations, which is an incredible development. And nowhere is that more the case than in medicine, and for a number of reasons. But there is a huge amount of money spent on healthcare, and being able to record what happens to people as a result of that is really a good investment. No one, I think, wishes to throw away money on things that don't help. And we didn't have much choice in years past. We tried our best. But now with the data that we can collect, we're really able to look on a very broad level about how healthcare works and which interventions are particularly helpful in what situations. Now that revolution is just beginning in chiropractic, and we're very fortunate in a number of ways that it is just beginning, because it's a tough startup. A lot of mistakes have been made, and someone in our position who's starting a few years or decades back can really learn from that and avoid some of the mistakes that early adoption of technology sometimes brings. But if you don't believe me that big data is actually a thing that is coming into our profession, it's quite clear that we're undergoing an evolution of really significant proportions. When the profession started, there was, of course, a founder, D.D. Palmer, and whatever that one individual said is kind of what defined the profession. And then there were others in the royal family who added to that. And unfortunately, or otherwise, the Palmer family wasn't that prolific. They had other children, but they maybe didn't stay active in this area. And others started to take up where they left off. But it was still opinion-based leadership. I think you should do this. I've developed a technique and it's the one. But now we're very much into a situation where someone's opinion really can't lead entire thoughts about healthcare. And the only thing that really gives us something that is free of political influence is data. Now, we still need humans to make that data live. The data itself has no voice, and we need ethical stewardship of that data to make sure it's represented properly in healthcare. But the idea of evidence-based leadership, not just evidence-based practice, but evidence-based leadership is perhaps more important today than ever before. The days of personality-driven, charm-driven leadership are long gone. But how does that little soliloquy help us in terms of the profession? Well, there's some very good examples of how big data is transforming practice already. Optum Health, a very, very big insurance provider in the United States, is showing from their data that if you push or randomize people to conservative care first, before you allow them to go to other specialists or primary care, they actually spend less and have better outcomes. Now, that would not be something that we could do traditionally in chiropractic, where we've counted on relationships and good intents to put our agenda forward. It's not enough now to have a vision of what chiropractic should be. Our vision has to be driven from the data. And you just can't come up with this data necessarily in any old research study. We have to get access to it at a very, very large level. And unfortunately, there's not a lot of public data available for chiropractic. In most jurisdictions, chiropractic remains unfunded by the government, which means there's less incentive to keep track of how the money is being spent. Public funding usually means a great degree of oversight, and that means we can look through that data as a result of that oversight and mine it for various ideas and information. But we're very fortunate that some private databases like Optum Health has made their results known, that from their data they are able to then make these policies that are not just advantageous for healthcare professions, but for patients and for their bottom line. And I spoke about this in a recent editorial piece in the Canadian Chiropractic magazine, that we are just a little bit of motivation away from doing the same thing ourselves. You know, it's one thing to ask a profession to do something completely new they've never done before, and it takes a lot of work. But every day, chiropractors in the field record what it is they do. And if we would simply find ways to make that electronic, we could then mine that information for what it is that our patients experience. And we all know stories, fantastic stories of people who get better in unique and interesting ways. And what if there are, 800 cases just like that across your country, but we've never been able to put them together? This could radically alter the scope of chiropractic, but we're leaving these kinds of discoveries on the table because it takes a little bit of time and a little bit of investment to be able to create an electronic database for our profession when we don't have someone else paying for it. Now imagine if we continue on this way. This is a famous hockey player, probably the greatest one who ever played. And in Canada, hockey's a big thing. This is Wayne Gretzky. He's the equivalent of the biggest superstar in any sport. And what if we didn't write down what he did? It would be very likely that he'd be a very good player at a young age, and everyone in the stands would have enjoyed watching him play. But what if there were no scores? What if there were no statistics? We might not have been able to identify a talent like him. And that is the analogy that I have for us today. We're doing good. The people who come to our stadiums get a good result from watching what we do and participating in what we do. But the world outside the stadium is not knowledgeable of what we can do because we fail to get the game report out there. Now, we do have some early days successes in this area. Some initiatives like this, like Jonathan's Care Response and others in the United States, are starting down this road. But it's not nearly enough. And at the very least, this requires our support. And we have to go bigger if we're going to be able to benefit from this. Because if nothing else, others will start to record what happens in musculoskeletal health and with various interventions. And you can imagine those with the data are the ones who will be able to benefit most. In fact, I think if we could capture this data ourselves, we could even provide access to it for other professions and create a self-sustaining revenue stream for the profession. But it just takes some time, it takes money, and it takes leadership. So that's, in a way, one look at what's happening in the future or down the road for big data in the profession. But there are some things right now that we can access in terms of big data sources that give us a little glimpse into how powerful this can be. And in the last year or so, we've published three papers on existing big data sources and how they can help inform us about the profession. And I'm going to focus on one today, and that is using big data and artificial intelligence to come up with new ideas of where we might look at research and innovation to better help our patients. Now, I think we've all had the experience of being told a fact or suddenly reading a paper or a book and the lights turn on. You did not put these connections or ideas together, and now suddenly your world has been opened up. And there's a school of thought that says in the medical or healthcare literature, there is now so much of it, it probably represents the biggest body of knowledge in the world. But clearly, no one person can put together all the different ideas that may be waiting there to be connected. And in fact, there's even some who think there are Nobel Prizes just sitting out there waiting for those who can connect the dots. And so as a result, there is disciplines who actually will go out and try to excavate these ideas from the existing big data that is out there. And the question is, though, do they even exist? This is a great idea. You know, it's like there are so many stars out there. There is a very good possibility that there are other forms of life, just given the magnitude of what exists. And similarly, the magnitude of words and knowledge and sentences in the healthcare literature suggests that there's at least one really good idea there. But, you know, we're not so good at seeing these patterns or looking at connections. And that's where artificial intelligence really shines. And if you don't know about artificial intelligence, it just really helps us see trends and combinations of things that our brain might not be readily open to. So this is an example of work from our university where someone used artificial intelligence to look at MRIs, and they were able to diagnose those with schizophrenia better than the clinicians who could do it with their usual techniques. So there's something about these images, very hard to understand what they are, but the artificial intelligence recognizes what they are and puts two and two together. Now, the same thing also happens with words. Words you can think of as MRIs. They just designate information and ideas. And are there new ideas in large collections of words, like there are in large collections of images? And yes, and in fact, before artificial intelligence even came along, this kind of thing was being done with something called natural language processing. And it's essentially what Google is based on. You know, when you run a search on Google for chiropractic, you just don't come up with every hit of the word. What you're doing is relying on these techniques to bring up the search results that have the best context. And that, if you remember the old days of search engines, Google blew everyone away when it first came out. So we use this technology every day. And essentially how it works, it was actually created at Google. And it's very simple. If you have a sentence like the quick brown fox jumps over the lazy dog, what the artificial intelligence does is it takes each of these words and it sees how close it is to other words. But it does it in thousands and thousands of words, or whatever you give it, so that some words appear consistently closer to other words. And perhaps there are words that appear closer to each other that we've never thought about, that those two things would be related, and they can turn on some light bulbs for us. And I'm going to show you exactly how that happened. But to just visualize this is a way of looking at a word cloud, and we're going to type in the word chiropractic, and it will automatically show you the distance and angle to other words. And this expresses how close the relationship is of the word chiropractic at the center of these axes to these other words. And we can zoom in and see which ones are closest, etc., etc. Well, people have used this approach already, and famously, this paper came out a little while ago from investigators in California, where they used this technique to mine the literature and see if there are some words that were connected in ways that they didn't expect, and perhaps that would reveal a new scientific discovery. And that's exactly what happened. They used these techniques to look for chemical materials that have thermoelectric properties. And these thermoelectric properties are described in various ways in the literature, etc., etc. But when they started to put the chemistry literature into these AI search engines, what they found is that way down the list of elements that they already knew to be thermoelectric, in the 300s down here, there were some chemical compounds that no one really understood that those were thermoelectric. But yet they were appearing in this list of words that tended to have these chemical compounds associated with terms related to thermoelectricity. So based on that, they did a really interesting thing. They actually found one of these chemical elements or compounds that was discovered to be thermoelectric in 2012. So what they did is they actually took the chemistry data, the chemistry literature, and they ran it through these artificial intelligence techniques, but they cut off the information at 2009. And what they were able to show is that this discovery, that this particular compound was thermoelectric, actually was findable in the literature in 2009, 3 years before it was actually discovered to be the case. So there is proof that there are ideas that exist out there in the literature of some really important discoveries if we can only discover ways to find them ourselves. So we thought, what if we did this for the whole literature in back pain? You know, back pain is a huge disability. It has a huge cost. There's a huge loss in terms of productivity for people. And yet we know so little about it. We're understanding how to better treat it, but imagine if we knew the causes of it, how much better we could do at aligning treatment to patients. So what we did is we took the entire PubMed abstract system and we ran it through a system like this. And I won't go through the specifics of how that is done, but essentially it's what I've told you has happened already. It takes all the words in the abstracts and it plots it in one of those word clouds, and then we can interrogate that word cloud to see if there might be new ideas. And this is kind of how it works. If I told, or if I don't tell the AI anything, but if the AI discovers that there's a consistent relationship in word distance between king and queen, then theoretically, if you put in something similar to king like man, then without knowing anything else, if you took this same angle and distance and took the same angle and distance and drew it away from man, lo and behold, there's a data point there for a woman. So this relationship between a male king and a female queen, this geometric relationship here is copied, or not copied, but is actually displayed again in a similar relationship of a man and a woman. And similarly, we can do the same. If we take a number of countries that we've run through this, there is a direction and a magnitude in the word cloud that if you just draw that arrow, you'll find the capital of that country. Same thing, draw the arrow the same distance at the same angle, and in the word cloud, you'll find that Rome is the capital of Italy. So the inherent way that people use words and write words conveys information about what these countries' capitals are, and without teaching anything or giving any hints to the artificial intelligence, it picks up on this. So this is our word cloud for low back pain. And there are a lot of words. And when you start to break it down, this is if we search for words related to treatment. Here's just a little sample of all these purple clouds. But if we put in anatomy, pathology, and treatment, then we can search the word cloud and we see that, and these are just small examples. Here is a group of words that is sitting very far apart from the other words, and they relate to treatment. But you can see the anatomy cloud in purple and the pathology cloud in green. There's some overlap here. We've got some of these things are bumping up against each other, and we've even got a purple dot sitting way over here in the green dots. So why is that? And I can tell you, we don't have any immediate discoveries here. Remember that in the chemical example, the new discoveries were hundreds of items down the list, and it took a sharp eye to find them. The problem is we don't have anyone who's made a discovery per se in chiropractic or in back pain that we can then go back in the literature and look and see if that existed. And in fact, even if we did, that would be, yeah, great, okay, we showed it. What we really want to try to do is use some techniques to see if we can predict what the discoveries are before they're discovered. And just as a proof of concept of this, what we were able to do is to take this idea of analogies, the same idea of king and queen and man and woman, and say that, okay, how good is this process doing for relationships that we already know about in back pain? So here we have an anatomy and pathology relationship. So what's a piece of anatomy that we typically associate a certain pathology with? So pars interarticularis and stress reaction. And we show that there's a really strong relationship between these two words. So then what we can do is we can plug in candidate words, different pieces of anatomy, spinal cord, gluteus maximus, and see what the result is. Will it find a pathology that's very strongly related to that anatomy? And we look at the scores, and there are ones that we know very well. Collapsed lamina, in this case, fatigability of gluteus maximus. And now we can use those ground truths to go explore, are there other analogies that maybe we're not aware of? What if in lamina there was some kind of remote hormonal problem that got associated here at a very high level, but no one had ever thought of that before? This is the kind of way that it might be possible to create new discoveries in different scientific disciplines. So with that, we thought, why don't we create a little tool to just let people explore? And that's exactly what we did. And you'll see this web address down below. You can take a photo of that and plug it into a browser and try this yourself. So you can put in pars interarticularis is to stress reaction, like king is to queen, as man is to blank, and you would find woman in a general word database. But in a PubMed database, we can be a little more specific about some things. So if pars interarticularis is to stress reaction, then spinal cord is to, and then it gives you all the possibilities and the score of how tightly related those words are. You can actually use this to look for similar words, and even below this banner, you can type in words and it will give you word clouds that you can look at the intersections. And analogies is just one way of trying to discover new things within the literature. We can use visual ways of doing this as well, where we want to say, okay, what are these things that are tied together? Like we saw the overlap of pathology and anatomy. Are there some overlaps or some unique ties between dots that we've never thought of before? So we've got some analogy tools, we've got some visualization tools, and the idea is to hopefully mine this big data for big new ideas. So with that, I'm giving you just a little bit of a look at what I think is going to happen in the future with the profession in big data. We have also done some recent publications that looked at Twitter data and how it might inform us as to what people are talking about in, most recently, topics of immunity and manipulation. And we've also looked at it for regulation, how big data can be used to help regulators understand what it is that their members are saying about chiropractic in their own tweets and in their own websites. So thank you very much for the opportunity. This, of course, doesn't happen all by myself. We have a very big, talented team of students and collaborators who help us with all of this, and as well as funders who make sure that the work can be supported and get done. And so thank you with that. I wish you all the best with the other lectures and speakers that you might be looking at in this particular gathering, and I hope one day soon we'll be able to do this in person and get to know each other in 3 dimensions once again. Thank you very much.